A patient no-show rate of just 12% costs healthcare organizations almost $90,000 per year. Think about how substantial that is. 12% is an overwhelming minority of people not showing up to their scheduled appointment. Yet the cost associated with them adds up to more than the annual salaries of some of the staff. Sure, there are things healthcare organizations can implement that will reduce their rate of patient no-shows. It won't ever reach 0%. There are just too many factors involved to not have some patients who don't come to their appointment. But your organization could provide the best financial assistance in the world and most convenient scheduling practices available, yet you'll still have some patients not come to your doors because of the personal matters that pop up. The point I'm trying to make after all this is that every healthcare organization has to implement a follow-up process if a patient ditches on them. A major part of that process requires that you communicate to the no-show patient. They need to know that what you did hurts your organization and comes with consequences. Hi everyone, I'm Matt from eTactics, and today I'm going to show you effective patient no-show letters. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. Everyone gets a second chance. Unless your practice is trying to force its patients out by being overly strict on the experience it provides, it should have some leniency when it comes to patients not coming in for their appointments. On the industry level, patient no-shows cost $150 billion every year. That's money no healthcare facility can afford to lose. The first example letter I have for you comes from a dermatology office, Skin Iowa PC. It reemphasizes the point I made earlier in this section that everyone deserves a second chance. This letter template is a good example of what you should send to your no-shows the first time they ditch their appointment. Yes, it's lenient and understanding. Yet that's exactly what you should send the first time one of your clients ghosts you. That way you're reminding them of your policy while saving on your patient experience. The second effective example focuses on workflow. It's safe to assume that the majority of people learn effectively from an established process. The second patient no-show letter template I have for you comes from Pacific Crest Family Medicine. When reading it, you'll notice that it's much more corporate in tone. What I mean by that is the words on the page aren't personal. They simply say what's truth and that they're explaining what happened. Using a corporate tone covers all of your bases by describing everything as it is. It's a helpful tone to use for multiple no-show offenders. The most important takeaway from this template is what Pacific Coast Family Medicine provided at the bottom, the procedure steps. This is a brilliant move as it provides as much transparency as possible as to what happens the moment a no-show occurs. My third example harps on policy. Now, policies exist for a reason. Senior management determines that a certain process or ethic is important and creates a policy around it. Regenesis Healthcare did a great job of creating an effective no-show letter that forces the delinquent patient to reread its policy and acknowledge that they've done so with a provided signature line. Finally, some healthcare organizations create no-show policies that require monetary penalties to compensate for the uncontrollable loss of business. It's a tough consequence that sometimes leads to angry phone calls to the practice's support team. Yet, its strictness could be enough to ensure that your clients show up for what they've scheduled themselves to show up for. Metropolitan ENT uses a similar approach to Regenesis Healthcare from a previous section, but they also include a fine for appointment ditching. They include how much money the organization charges for no-shows, that the fee isn't covered by insurance, bonus points for this, and that their clients must satisfy balances over $100 before requesting future services. It also includes acknowledgement via a signature. Now, establishing a no-show policy is something every healthcare organization should consider implementing. Once approved and established, patients will be less likely to ditch their scheduled appointments, saving the practice thousands of money annually. But life happens. It's impossible for any healthcare organization, regardless of its size, to not experience no-shows on some level. If you'd like to learn more about patient no-shows, reach out to eTactics. And you already made this far into the video, so you might as well like it, share it, and comment below. Well, what are you waiting for? Subscribe to our YouTube channel.